My name is Daniel Swärd. I have the great pleasure to sit here with Nouchine Hadjikhani, Associate Professor at Harvard, Professor in Gothenburg at Sahlgrenska, and you are a specialist on the brain.
Yes.
On the possibilities and the limitations and the diseases of the brain. And one common disease is migraine.
Yes.
A special field of yours. And unfortunately, there is a lot of women that has it compared to men.
Yes.
And you have it and I don't. So there's but you kind of you learned your own routines. You kind of looked introspective on your own life, and you saw that on Saturdays it usually occurs in your life, and then you don't have the right eat routines.
Yeah, exactly. I realized that if I was not eating at the proper time, then I would start having a migraine, and that was easy to address.
Yeah.
So.
And I have regular headaches, and they're based in the muscles, but migraine is based within the brain.
Yes. So what happens when you have a migraine attack is that you have cells that start firing in an abnormal way, and they release all kind of substances that go and irritate the meninges, which is the thing that cover the brain, and they have blood vessels and nerves around these blood vessels, and the pain comes from this irritation of the meninges.
Yeah, and early on in life, at young people, you can see it, but then they often complain they have a stomach.
Yeah, so children often don't say they have a pain in their head, but often it manifests itself more as a belly pain, and as they grow older, they will start having more headaches, migraine headaches. What is also more common, I mean, when you look at the history of people who have migraine, often as children they were sick when they were in the car.
Yeah.
So there is some oversensitivity of the visual system in migraine. That's yeah.
And you also see that there's a greater risk of Alzheimer's disease.
Well, that's there are some statistics that seem to show that migraineurs, there are more migraineurs who have that. What happens is when you have repetitive episodes of migraines, you have repetitive drop in your blood flow in the brain, and if you are already a little bit compromised, that can actually make things worse, and there are several studies that have shown tiny infarcts in the white matter of migraineurs compared to control. But again, it's not because you are a migraineur that you will have Alzheimer's disease. I don't want people to panic about hearing things like that. But
if you're a young person and you suffer from migraine, it's hard to with school. If you want to become a doctor just like you, what advice can you give to the next generation to handle this disease throughout life?
I think having a good life hygiene is very important, getting enough sleep, knowing which food trigger a migraine, and for that you need to kind of have a migraine diary and write down what you did before you got a migraine and try to eliminate things that are bad for you. Get regular exercise, but not crazy exercise. I mean, you don't want to dehydrate yourself to the point that you will have a migraine probably. So having go out and walk and breathe and do things like common sense things.
And they can decrease the number of migraines you get in a year.
Yes.
Because it's very individual. Some people get it like 3 times a week.
Yes. And yeah, some people really are very handicapped by their migraines, and other people just get a few attacks. And of course then there are also drugs that can help for people who get a lot of migraines. There are different types of drugs that can be tried and alone or in combination, and but you have to be very patient and yeah.
And the problem is that if you use it too often, then it turns the other way.
So not the drugs that prevent migraine, but the drugs that treat the migraine attacks. If you take too much of that, then you can go into this vicious circle and have rebound migraines. And a lot of people who they take too many pain medicine, and at the end they get migraine headaches because of not having it. As soon as they stop taking the pain medicine, it's like a drug, if you want. So you have to be very careful about that,
and ordinary people, they need something extra, in order to be extra happy in life, so to say. If they win the lottery, or the sun is up, or a good meal or so. But when you have had migraine and you wake up without it, it's a blissful day.
Yes.
In some sense. Can we learn something from the joy that comes with just being without
hopefully
pain?
Yeah, no, I think it's when everything is fine, we take it for granted, and often we need something bad to happen to realize how wonderful it was before it happened, and it would be good for people to realize that it is really nice to wake up with no pain, and what we consider normal is actually fantastic.
Yeah. And your own studies now, what are you finding at Harvard?
In the field of migraine?
Yeah.
What we've been seeing recently is that we've been able to, for the first time, actually show this neuroinflammation in the brain, because before we had the theory of what happens in the brain during a migraine attack, which is something we call cortical spreading depression, and we knew about the pain itself, but nobody was able to show that inflammation that we knew from the animal model and from the theory, but we had not been seeing that, and we just did a study recently where we were able to actually show this inflammation of the meninges and of specific areas of the brain.
And there's a new vaccine coming out.
Yes.
That hopefully will be a game changer, but you said that in the past there's been a lot of failed game changers.
Yeah, every time there is a new drug for migraine, there is a lot of hope that goes along with it. And so this CGRP antagonist drug hopefully will be a help, but we need time and studies to show that.
And you're a big reader as well.
Yes.
And you studied literature at university as well. Do you find any writings way back when on Dostoevsky and the big writers from Greece and so on, where you can see migraine in the literature?
I think Alice in Wonderland may be the nicest example, because Lewis Carroll's description of Alice feeling like she's getting very, very big or very, very small is something that now is called the Alice in Wonderland syndrome, which is one of the prodromic symptom of migraine, or it can be one type of aura in migraine. So
and there's something that comes before the migraine.
Yeah, that's the aura.
Yeah.
So people sometimes, before they have the headache phase, have neurological symptoms, and most often it's visual, and like dots and little zigzags that start in the center and grow into the periphery, and often followed by a scotoma, so people can't see very well for a while, and then the headache starts. But those are the common visual ones, but you can also have paresthesia, like you have little feelings that go up your arm and then your face, and then weakness also. And then you can have all kind of bizarre things like this Alice in Wonderland syndrome, or having difficulties recognizing people, or all kind of other things. It depends on which part of the brain is affected. Then you'll have symptoms that are in relationship to that.
And if you have a family member with migraine, a wife or a kid, what advice could you give to them in order to strengthen the family?
First, it's an inheritable disease, so often people who have migraine, you find that in the family, often, the mother, the aunt also had migraine.
Yeah.
So you have to be aware of that, and the advice is, just respect that the fact that they have to go and hide somewhere when they have a migraine, it's real. It's very painful, and you shouldn't push them.
And migraine, has it increased in society over the last years, or
I don't think so. I think it's quite of a stable thing. Maybe tension headache is more common because people are more tensed.
Yeah.
But I think migraine is pretty stable.
And within your lifespan, will we be able to erase it?
Probably not erase it. Maybe treat it better. But I don't think any disease will be completely erased, unfortunately.
Fantastic. We hope for the best, and the best of luck with your important research.
Thank you.
Thanks a lot. Thanks a lot.